Hi, my name is Raylan Renicky and I will be demonstrating an IM injection as well as a sub-Q injection. Okay, so I've got my EHR here and my client's history. Before I enter the client's room, I am going to verify the orders to see what I am doing. So I have Joanne Peterson here, 12/10/47. She has no known allergies. She was recently admitted to the medical surgical unit. Past medical history is hypertension as well as asthma. Admitting diagnosis is dehydration and due to falls. She's having falls. Medications, furosemide, albuterol, Tylenol. Weight is 145 pounds. Vital signs are currently within normal limits. Temperature is a little bit elevated. She's alert and oriented. Breath sounds are clear, unlabored breathing. GU, she's voided 100 milliliters in the last hour. Perla intact. She has an IV in her right arm, but she does not have an IV intact on this mannequin, so we're just going to go ahead and use the left arm. So she has a high risk for falls. She has some soreness from falling, but no broken bones. Her admission database has been completed, and she has orders from her physician to begin a flu vaccine, and we're going to do that now. So we're going to start with the flu zone in this video. Vaccine. Okay, so I'm not seeing any allergies in the chart that would indicate that she can't receive this vaccine. We're going to give this vaccine because she is over the age of 65 and is at an increased risk for complications. So just looking at the chart, we're going to do flu zone, 5 mils. I'm going to go into the client's room and I am going to see how they feel about receiving a vaccine. Hi, my name is Raylan. I'll be your student nurse today. Provide privacy. I'm going to do hand hygiene. Before we begin, would you give me your name and date of birth, please?
Joanne Peterson, 12/10/47.
Let me see your wristband. Nice, there you go. Matches the EHR, very good. Do you have any known allergies?
No.
Okay, that's what my chart says also. So I see that you are due for a vaccine according to your provider. It's for the typical influenza for the season. Have you had a flu shot in the past, maybe in the last year, last few years, ever?
I don't even remember when I last had it.
Okay, that's what the chart says also. So the vaccine, we're going to give this because you are at an increased risk for developing complications associated with the common cold, the common flu. These complications could be things like developing worsening symptoms, which could lead to pneumonia, perhaps inflammation of multiple organs, maybe organ failure. The benefit of this is decreasing those symptoms or preventing those symptoms entirely. Is that something you're interested in?
Yeah.
Okay, very nice. So the IM, it's a muscle injection. So we could give this in your deltoid muscle, we could give this in your ventrogluteal, or we could give it in your vastus lateralis. But the most common is in your deltoid muscle. Is that okay?
Okay.
Okay, so I'm just going to assess your skin site. I'm not going to wear gloves because your skin is intact and clean. So I'm just looking at your skin around your deltoid muscle. Do you have any pain here?
No.
Okay, and this is on your non-IV arm. Are you having any irritation or anything with your skin?
No, not
Okay,
at all.
it looks good. So I'm going to go ahead and go prepare that medication. I will be back in a few minutes, okay?
Okay.
Okay, so hand hygiene. Make sure the client is comfortable. Make sure the bed is low. Okay, it is. They have their collar. Open the curtain. Okay, so now I'm going to prepare the vaccine. So I'm going to begin by removing the medication from the storage unit. And I've got flu zone. Okay, with matches. We're doing Joanne Peterson. Nice. The dose, we're doing 0.5 mils. 0.5 mils, we get there. The time is now. IM injection, or intramuscular injection. Okay. I'll shake it up a little bit. Okay. IM, the time now, the reason for the flu. Okay, so we've done our first thing, and I'm also going to look at the expiration dates. Make sure the medication is clear, it's intact, and it is. So we're doing the first med check. Now I'm just going to gather my supplies to do this intramuscular injection. So we're doing 0.5 mils. So I want 0.5 mils. Good. It's intact. Okay. We're going to do our blunt tip needle to draw up the medication. That's intact. And I'm also going to do a 25 gauge. I could do a 22 to 25 gauge for IM, and I'm using a 1 inch because on the chart for her weight, which is 145, we would use a 1 inch needle length for this person's body size. So that is intact, looks good. And I've got my cleaning stuff here. I'm not going to wear gloves for drawing up medicine because I do not need to. So I'm going to do my second med check here, and we're doing the flu zone. Flu zone, influenza vaccine. Okay, we're going to do 0.5 mils, syringe matches. The time is now, the route IM. Okay, and the reason to prevent complications of vaccine, of influenza. So I'm going to clean my vial for 15 seconds. Okay, we'll say 15 seconds has gone by. We're going to let that completely dry. Okay, so while we do that, we're going to do the blunt tip needle. .5 mils. Maintain sterility here. I'm going to drop 0.5 mils of air. Oh. Actually, I don't think I do it that first. I'll attach this first. Okay, there we go. Now I'll do 0.5 mils of air. Okay. Okay, this is dry. I'm going to insert 0.5 mils of air. Looking for bubbles, which it's making a ton of bubbles with this. I'm going to remove this. I'm going to safely recap this. And I would put this in my sharps. Just bring this in the room and put it on. So if you want to look at this, I have 0.5 mils, 0.5 mils. So if you'd like to look, 0.5 mils of flu zone. Okay, so I've done my 2 med checks. I'm going to bring my needle in there with me since my sharp spin is in the client's room. Got my alcohol prep pads, and I'm going to bring my vial with me to do my med check along with my syringe. If I bring in multiple syringe medications, I would put a label on this. Since I'm bringing it together, we're just going to do it that way. Okay, so I'm going to head into my client's room. Hello. Hi, it's Raylan. I have returned your student nurse. Provide privacy. Okay. So, organizing my supplies here. And hygiene. Okay, before we begin, would you give me your name and date of birth again, please?
Joanne Peterson, 12/10/47.
Joanne Peterson, 12/10/47. Perfect. Okay, do you have any known allergies?
No.
Okay, nice. So we are going to do the vaccine for the influenza. Some side effects right away could be maybe some soreness at the injection site. That could develop within 1 to 2 days. Some other side effects could maybe be some flu-like symptoms within 1 to 2 days. They should resolve on their own, but if the symptoms are too severe, you can come into the clinic and we can give you a medical treatment. This virus or this vaccine does not include any of the living virus, so it is not possible to contract the actual flu from the vaccine, but you could develop flu-like symptoms, but it is not the flu. So is it okay if we go ahead with this?
Okay.
Okay, so I am going to apply my gloves. I'm going to go ahead and do my third med check. We've got Joanne Peterson, very nice. And the medication that we are doing is Fluzone. Fluzone influenza, yes, we're doing 0.5 mils. 0.5 mils, very nice. The time is now. The route we're doing intramuscularly. Looking at this to make sure it's intramuscularly, nice. And this is because we are preventing complications of influenza. She has an increased risk because of her age. Okay, we've done our third check. So now I'm going to just expose enough skin. We're gonna do the deltoid muscle. I'm going to clean the deltoid muscle starting from the inside out for about 15 seconds. Okay, and I'm just gonna mark my little spot there. I've done that. Oh, I forgot to do something else. So we're gonna backtrack for a second. Oh, that fell. So we are actually going to take my blunt tip needle off. Okay, that's good. Okay, I'm once again going to remove that, and I don't need that. Okay, so I would do 3 finger lengths down from the chromium process and pull the skin taut, and I'm going to go in like a dart. Here we go, 90 degrees. In we go. And I'm just going to insert that. I have to back it out a little bit so the liquid injects. Can pull that out. Clip this, and I would just drop the whole thing in here. But for the lab purpose, I'm going to keep the syringe. We're going to keep that. Okay, so would you like a Band-Aid?
Yeah.
Put a Band-Aid if you want. You aren't bleeding, so that's okay. Any pain at the injection site, any discomfort, nervousness, anxiety, you're okay?
Okay.
Okay, very good. So I'm going to gather my supplies, clean up, take my gloves off, hand sanitize. Okay. So if you start to develop feelings of anxiety or pain at your injection site, just let me know.
Okay.
You are at an increased fall risk right now, so if you need anything, please call me and I will assist you if you want to use the bathroom or go for a walk or whatever. Make sure you have your call lights, your bed's in a comfortable position, you're low. I'm going to raise your head a little bit. Side rails are up. Okay, I've got my supplies. And I would stay with the client for a few minutes just to ensure that they're safe and that they're doing okay. So I'm going to open the curtain, throw my things, exit the room, document the things that I've done where I injected the site. And then 15 minutes later or so, I would return to the client's room.
Yeah.
Hi.
Hi.
I'm your student nurse again. Just checking in. How are you doing? Any pain at your injection site?
I'm doing fine.
Okay, I'm just going to take a look, make sure everything's all right. Okay, nice, looks good, skin looks all right. Okay, if you have any questions or if you would like to get up or anything, make sure you call me so I can assist you, okay?
Okay.
Okay, you have your call light, side rails up, looking good. Okay, I'll see you later. Bye-bye.
Okay,
That's
bye.
the end of the IMinjection.